Look at her. You never know how bad things were just a few months ago. Hear that? That's the sound of my wife getting a terrible night's sleep and being too tired to help around the house tomorrow. Here's a neat little game we like to play every night, where I apply just enough pressure to get her to stop snoring.
She's trying to sleep, honey!
I should have listened to her college roommate's warnings. Around here, a good night's sleep is like Santa Claus or unicorns or polite political conversations on Facebook. It doesn't exist! For years, we were both constantly sleep deprived. Kim's not the only one who has to find alternative means of making it through the day without that deep, restful sleep. We went to our family doctor and learned that snoring is more than just an annoying habit. Dr. Jones said that snoring is a serious medical condition which can impact the quality of your overall health. Snoring has been associated with headache, sore throat, sleep apnea, chest pain, high blood pressure. I feel like I'm forgetting something.
It's never been this late.
And this is her favorite TV show. We tried everything. Medication, nose strips, a ridiculous looking head brace. Talk about being in the mood, am I right? We even Googled alternative remedies, which was so not helpful. Now the reviews online said that this shouldn't hurt a bit.
Okay.
So... No, honey, you gotta eat all of them. Yep, in the mouth. Ooh, I can smell it. I can already smell it. The garlic only gave Kim's snoring a pungent Italian aroma. Kids, breakfast! Finally, we accepted defeat and brought home the dreaded CPAP machine, which Kim said was worse than all the others combined.
Mommy, I had a bad dream.
Did you say something? That was the last straw. And that's when I found the ad for the VIVOS appliance. So, we made an appointment, and we found out that Kim's snoring was caused by a narrow airway. Let me explain. When you fall asleep, muscles in the back of your throat relax, causing your airway to constrict. For people like Kim who already have a narrow airway, this leaves very little room for air to pass through, which causes vibrations or snoring. The VIVOS appliance is a simple-to-use mouthpiece, kind of like a retainer, that gently expands the upper arches of your mouth, increasing the size of the nasal cavity, maximizing airflow volume, which reduces snoring and delivers more oxygen to the body. You simply put it in each night before bedtime and take it out in the morning. It's usually pain-free. In fact, she often forgets she's even wearing it. Here you go, guys.
Bye, Dad.
Bye, my love. Have a good day. Bye, love.
Have a good day.
Now Kim wakes up happy and rested. And so do I. Yes, I do. Ooh, someone needs a change. Now she sleeps silently right through the night. And because it causes permanent structural change, she's also breathing better during the day. So she's seeing all kinds of health benefits. The VIVOS appliance really has changed both our lives.
Hey, babe. It's been a while since we've spent time together.
Also, half my jaw was underdeveloped, so one of my joints was half the size of the other one, and I was getting really, really bad migraines. Very uncomfortable having TMJ. The jaw popping is just, it gets annoying, and I started to not notice it after a while, but every time I ate, everyone was like, oh my gosh, you need to get that fixed, it can't be good. And obviously it was super bad, so like as it kept getting worse and worse, and sometimes you can see like my jaw would go like to the side every time I opened. It just was little headaches at first, but then it started to be like, light started to hurt my eyes, and like studying for school was really, really hard, and it just made life like not fun. So I went in for a regular dental checkup with Dr. Caulfield, and he noticed that whenever my bite was way off and none of my back teeth were touching, and so that was his first suggestion, was the VIVOS system. Immediately I noticed a difference within like the first month of using it. All my migraines were gone completely. My jaw popping started to go away. People have stopped noticing it, which is really cool. It was like I could study longer, you know, which nobody wants to do, but it was so amazing. Magic. It was cool. I can't wrap my head around it. Sorry.
Why are you getting emotional?
Oh gosh, I don't know. Just because I'm so happy that I don't have migraines and stuff anymore. It's hard to live with, so. Yeah, me too. Sorry. I never really talked about it yet, so this is cool. It definitely changed my life. And it was totally worth it. VIVOS team, thanks for helping fix my TMJ problems and changing my life. I'm a biomedical engineer, so hopefully I can help change lives too, like you guys.
It was like an aha moment, because we've been to all these specialists, we've been to a hospital, nobody mentioned TMJ, not once.
The migraines I was experiencing before the VIVOS system were extremely debilitating. I would basically be put up in my bed with a pillow over my face, sunglasses on, dead quiet room, nothing going on, and it's still getting worse, and my head's still pounding.
And we did actually take him to the emergency room twice, and they did a workup of CAT scan, blood work, spinal tap that was actually horrible. It took them 4 times to get it, and when you have a headache, oh, it was awful to watch him go through that.
They weren't able to find anything.
You know, watching him suffer, his life at such a young age, totally affected. He couldn't do anything.
It was 4 months or so straight of a migraine where it didn't go away at all.
And then I think it was about a week later we ended up in the emergency room again because it was so bad and so debilitating. Missing school, I mean, you name it, it was horrible.
Been to neurologists, seen a lot of doctors for it, and we were just struggling.
And the neurologist literally sat him down, checked his reflexes, and then wrote out like 7 medications to give him and said, go ahead and try these. It made him into a zombie. Then one Sunday we were at church, and Dr. Caulfield knew what was going on, and he walked up to us and looked at Adam, and he said, you guys, I think I can help him.
He started looking at my face, and he was able to point out that my eyes were crooked and that my left eye would close a little bit, whereas my right eye would be wide open. And so he started pointing out these things that suggested that I had some TMJ issues, as well as maybe some teeth issues. And
TMJ really can be a cause of migraines, and he said, I'd love to, if you're willing, to take a look at him.
Sure enough, we went and did the consultation with him, and pretty quickly we were able to determine that there was a strong possibility that the VIVOS system was going to be able to do a lot for me. And we didn't know quite what that meant, but our expectations were fairly high, and they ended up being well exceeded. Within about 2 or 3 months, I began to see a very substantial difference. My migraines were going away. Medication would completely get rid of them instead of barely touch them. And fairly quickly, within about 4 months, I was off all of my migraine medication.
It was so amazing that there was no doubt in our minds that the VIVOS system is what changed his life and corrected the root cause instead of covering it up with medicines.
My migraines are completely gone. A headache for me is extremely rare, and it's pretty much no big deal now.
Words can't explain my thankfulness for the VIVOS system, because it literally changed the course of his life, because where he was headed was horrible.
It's completely part of my past. I think about it every now and then, but I'm living a completely different life and have totally moved on from the struggles I had there with migraines.
So I just can't even explain how much we appreciate it and what it's done for him.
Not only did it get rid of my migraines, but it gave me great teeth and stuff that I'm really happy about. I can be happy about the way my teeth are now without having a headache while I'm trying to look at my teeth, and so it's just fantastic. I have so many thanks to give to the VIVOS system and everyone behind it.
I'm Deb Kozer. I live in Freeport, Florida, and I'm retired. I love it. My cats are a big part of my life. My favorite thing to do is cook, and I cook all the time.
Which is why I'm on a diet.
I've never really been a good sleeper. It has affected my life, because when you're tired, you can't function. You're running on adrenaline. You're living on, caffeine.
Patience is
not always there. You're tired. You have to really fire up to try to get things done in the house and things done in your personal life. It's very, very difficult to function with no sleep. I didn't dream. I woke up in pain. I tossed and turned. Something clearly wasn't right.
Well, I know how she responded to the sleep study she had, and when they attempted to utilize a sleep apnea face mask, I'll just say it didn't go well.
The CPAP mask was a nightmare. I had an issue with a narrow airway, but I had been told that before, and I met with an ENT that it was highly recommended, and he opened his mouth and showed me his throat, and he showed me mine, and I have to say, I looked like I had no space in there at all, and he had this huge monstrous airway, and I'm like, okay, I clearly see what we're talking about now. But he said primarily what I would recommend is we actually go in and you would cut the roof of your mouth and we cut the back of your throat. And I'm listening to this just horrified. And at that point, I saw an advertisement for Dr. Griffin. Finding this VIVOS device with Dr. Griffin was absolutely a godsend, because it gave me some options that I could have without all the pain and discomfort and being cut open, increasing the size of the interior of my mouth and enlarging the airway for me. It wasn't real long that I started to notice a difference, because I was making progress. The roof of my mouth was expanding, my airway was expanding. I put it in, I go to sleep, I don't roll around all night. It's amazing. I noticed I had to be sleeping better because I was dreaming all the time, and I don't recall doing that very often. Put it in and it's like, I'm ready to go to bed, and it's great. I sleep much better, and it's so much better. Last night I probably was out I don't remember even, I put my head in the pillow and I probably was out within 30 seconds. So it was really cool. That's just not something that happened. A big part of this whole thing falls back on the fact that I have extremely bad arthritis, and pain is a big deal. And when I'm rested, and I'm not, especially this is real key to me, especially not constantly tossing and turning 40, 50 times a night, I wake up and I'm not in pain, as opposed to waking up in excruciating pain a lot of times. I never sleep without it. It's just a part of my sleep routine now, because I sleep better. I feel better. It's a win-win for me.
You can tell one of the things that helps, because she's sleeping better, is her attitude during the day is better. Mm-hmm. And a little bit more patience goes a long way with me.
This is a much better option. It's much more benign, it's much more comfortable, and it's effective.
For her, it was definitely the way to go.
I can't say enough good about it. It's just really, really helped me a lot. I'm just have a better quality of life now. I have so much more energy to cook since since I'm more rested. The neighbors love it when Deb's baking. It's just relaxing. I'm able to stand in the kitchen and I'll bake for 10 hours straight. And I
Cookies
couldn't do
and
that
cookies
before.
and more cookies.
Yeah, so my name is Dr. John Caulfield in Littleton, Colorado, in the Ken Carroll area. We're here at my office at Epic Dentistry. Yeah, so when I was very young, I used a pacifier. For a long time, my mother worked nights, so my dad would have to feed me with a bottle, and bottle feeding is one of the big things pacifier uses. Those are the kind of things that actually suppress our jaws and our mouths from growing forward and down like they're supposed to. And so now my muscles and my joints were suffering for that. As I started doing dentistry, as I started getting into, I think, some more stressful situations and work postures and things like that, that's when I started to notice my jaw popping a little bit, my ears were getting occluded, I could always hear kind of like a muffled sound, it was affecting my hearing as all these things started to just get worse and worse. So I was attending a lecture with Dr. Singh. He was describing and explaining how our mouth and our jaw form and how important our tongue and the breathing is in that process. So as I started going through my symptoms and realizing and looking in the mirror at some of the things he said to look for, I was like, wow, this is something that could really help me. And so I went and got training with Dr. Singh, how to use the VIVOS system. And so what I did was made an appliance for myself that was very easy to wear, wore it evenings and nights, and that would actually grow and help my upper jaw grow, which helped my lower jaw grow forward, which really leveled out my muscles, leveled out my bite, and also helped open up my ears so I didn't have the same problems I was having. I would breathe through my nose, and I could feel how much more air I could take in through my nose, how much more I'd opened up my airway and the upper airway issue. And then also my jaw started feeling better, the clicking went away completely. My ears were opening up, I was finding less and less issues, like it was slowly unraveling and unwinding all the problems that had been building up. Yeah, so after completing my treatment, I was able to identify multiple patients that would come in, whether they came to see me for TMJ problems, whether they came to see me for sleep or snoring issues, whether they came to see me because they had chronic headaches, fatigue, neck pain. They would have these symptoms of their body just not feeling right. And I started realizing that the same way the little things I was feeling, some of these bigger things they were feeling, could also be treated in the same way. And so through that treatment and through the VIVOS system, I've been able to help many patients young and old. And so by now really changing the way someone's able to breathe, I'm able to change the way they live. The nose is really our breathing instrument. We're supposed to breathe through our nose. We're obligate nose breathers as humans and as mammals. We're supposed to breathe through our nose at all times. What's so great about this system is that by expanding and growing the upper jaw, we're actually expanding and growing the lower nose as well. So now breath can be taken through the nose much more readily, much more easily. When the air is going through our nose, and the oxygen that's coming into our body is able to be filtered and humidified and warmed before it enters our lungs. Those are huge benefits, along with multiple others, nitric oxide production, and some other things that really create the correct breathing, the way we're supposed to breathe, and the way we're supposed to oxygenate ourselves. Without breathing, we don't last more than 2 or 3 minutes. And so as we start to introduce the VIVOS system, it's able to not only move the teeth into a straighter position, but move the bones into a better position, and move the airway into a better position, and move the neck and the jaw all into a better position. And so what happens is the main benefit of straightening the teeth, really what we're doing is we're straightening out the symptom of other things that were lying behind that. And as patients start to get straighter teeth and feel even better, they're always amazed at all the other little benefits that come alongside of that. I love using the VIVOS system because I know I'm actually treating causes for the people. I'm actually helping people get to the really core base of what's causing their issues. After personally experienced it, it's really easy to turn around and go, okay, I'm going to be able to help this person, I'm going to help that person. This system allows me to make it convenient for anyone and also make it customized for anyone. This is not a quick fix, but it's an easy fix. And this is the ability to let the body truly get back to a place where it was supposed to be in the first place. And by breathing better and by sleeping better, you're going to be better.
The VIVOS appliance has basically changed my life. It's changed my family's life and has changed a lot of my patients' life. All of my children have had the VIVOS appliance. Gracie, my youngest, has had it since she was 6 years old. And she basically went from a bulldog, a class 3, to a normal bite, normal airway, normal little girl, no surgery involved. All of my children have had the appliance. I myself have used the appliance. It is why I'm still practicing today. I'd been in practice for about 15 years, and I was starting to have some trouble with my back and my neck and my hands. I wasn't sleeping all night long. I didn't put 2 and 2 together. The minute I got the VIVOS appliance and found out I could sleep through the night, didn't wake up at 2 or 3 in the morning with all this stuff going through my brain that I thought was stress, it actually all was airway. The minute my airway started to open up, the minute I stopped creaking my neck, moving my neck in a position to facilitate an airway that wasn't there, I no longer had neck pain. I no longer had numbness in my hands. That's honest to goodness. I mean, otherwise, I don't know if I would still be in dentistry. I'd be lecturing. The first VIVOS appliance, I sat with a patient. He went home, started using the appliance. The mom came back 2 weeks later ecstatic. "You've cured him." I said, "What do you mean I've cured him?" His little brother, they sleep in the same room. I put the VIVOS appliance in the patient. He stopped snoring. His younger brother started getting sleep at night, went off all of his ADD medicines. Was no longer attention deficit, was a total different child. I had a 10-year-old come in that had only had the appliance for 2 weeks. She rolled over and broke the appliance. And she knew she had to get it fixed. She started crying because she had to be without her appliance. A 10-year-old realized how well she slept after 2 weeks. That's a child, they don't lie. Several patients have come in with headaches, especially young patients have come in with headaches, and adults as well, but we have taken those patients in a matter of a few weeks of the appliance, the headaches are gone. So we have worked, and it's funny because that's one way to get the patients to wear the appliance. So some of the kids, when they don't sleep with the appliance, they wake up with headaches. When they do sleep with the appliance, there are no headaches. We had a young man come in that had exercise-induced asthma. Now, he already had spacing in his teeth, so it's an interesting case because he wanted ortho to close the spaces, but he didn't have tongue room. So we put him in a VIVOS appliance, we created tongue space, and in less than 3 months, he went to full participation in high school sports, where he couldn't before with the VIVOS appliance. Now again, anybody else would have closed those spaces down, but by paying attention to the tongue space and how little was there, we were able to keep his smile and give him the quality of life to enjoy what he liked to do, which is basketball. How we breathe is so very important. Do we breathe through our nose? Do we breathe through our mouth? Is the airway adequate to get sufficient air in and out without resistance? By increasing the airway, by increasing the oxygen flow, we can prevent things like fibromyalgia, chronic fatigue, high blood pressure, diabetes. Everything that I'm talking about, all those metabolic disorders are related to airway. So the more we do to benefit the airway, the entire body doesn't compensate and we have better health, better quality of life down the road. So when people think of smiles, they think of a beautiful smile. But behind that smile is tongue space and the airway. If we don't have room for the tongue, we have airway issues and the body compensates accordingly. The longer it compensates, the worse things can get. Sleep disordered breathing, apnea, snoring, chronic fatigue, fibro. There's 300 metabolic disorders that follow airway. So when we look at patients, we're looking at available tongue space, we're looking at the airway in general, and we're looking at the way to improve that. And in doing so, with the VIVOS appliance, we can not only accommodate that, we can also create a beautiful smile. The difference between the VIVOS and orthodontics is, again, it's not an inflammatory process. We're not pushing things through, there's no pain. So by working with the body, when we move the teeth, we move foundation around the teeth. By moving the foundation, we'll make a straw into a snorkel. So our CT scans before and after verify we are literally changing the airways, oral airway and the nasal airway. We're turning mouth breathers into nose breathers. So by creating the nice smile, the perfect smile, the smile that is U-shaped, not V-shaped, not cut in where the molars start, we need to look at that molar space. And we don't in orthodontics. We look at what we see visually up front. It's everything behind that is so important. So if you have headaches, if you have TMJ, if you have airway issues, if you have snoring, if you're grinding your teeth, if you're wearing your teeth down, if you have crowding, I strongly recommend you come in, at least get an opinion, just get an idea of what the VIVOS product is all about.
Probably about 7 years ago, I noticed I didn't sleep as well as I used to. It kind of came on gradually, and as the years went by, it got so bad, I told my wife, I said, I need to go see a doctor. Something's got to change. I can't keep going through life without getting any sleep. I would wake up and get out of the bed and feel just miserable. I'd feel physically worn out. I yawned all day long. After lunch every day, I had to fight dozing off. I quit dreaming. That was a big problem, just getting no restorative rest. When you have no sleep, you have no patience. You just, you can get upset at the least little thing. So I went to a pulmonologist and I had a sleep study, and they determined that I have obstructive sleep apnea. I don't snore, I basically just choke. I quit breathing at night. There's something in my throat, I guess, or in the back of my mouth becomes obstructed. And so I started using a CPAP, used it for about a year, really hated it, very uncomfortable. I tried several different types. I could never get comfortable with sleeping with a CPAP. And so I started doing some research. I wanted to find another answer. There were some dentists that had this procedure that they offered. And so I contacted a dentist here in town, Dr. Griffin, and made an appointment. Well, initially Dr. Griffin, she looked in my mouth and she took some measurements, and she told me that I had a narrow palate and that she thought I was a good candidate for the VIVOS device. And she showed it to me, and it kind of explained how it worked. That's how we got started. The first 2 weeks, I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I'm supposed to wear this device every day for a minimum of 12 hours, and Dr. Griffin said it could take a full year. I've seen benefits from the first 2 weeks. I haven't had any trouble wearing the device for 12 hours. On the weekend, I wear it 16, 18 hours, no problem. It doesn't bother me to be in my mouth. I'm able to pass air, and I'm able to breathe at night, and I'm able to sleep and dream, and I'm getting that restorative REM sleep. So for me, I'm getting instant benefit from it. Oh, I think I'm getting 7 to 8 hours of sleep now. I'm having dreams unlike I've ever had before. You go 6 or 7 years where you don't have dreams, and you notice it's a big deal when you all of a sudden start having dreams again. I tell my wife, I'm not just having little dreams, it's like a movie's running in my head. So I know I'm getting that restorative REM sleep. I know I am, because I wake up and I can tell you about the movie that ran in my head last night that we call dreams. I feel sharp now. I don't feel drowsy all the time, and that's a huge difference. I don't fall asleep in my chair anymore. I can watch the news. I can get down on the floor and play with my dogs. I can take them for a walk, take them to the dog park, and I actually think to myself, wow, it's been a long time since I felt this good. It's been amazing. Like from day one, I wouldn't lay down and try to sleep right now without my VIVOS device.
I'm Sarah Warner, and this is Hannah Warner, my daughter, and we went to 2 separate orthodontists who said the treatment would take so long into college, and that it would be a lot of expense, and she really didn't want to have braces in her senior pictures or go to college with them, and we just wanted an alternative. We wanted to look and see what else there was out there.
I definitely felt hopeless, like I should have started it a long time ago, and you can't go back in time.
Hannah had lots of spaces in her teeth, and her teeth were crooked and very, very small.
I didn't want to show my teeth at all, and I always didn't smile fully with my teeth in pictures. I would open mouth breathe. I could never close my mouth to breathe. Sometimes I would snore in my sleep, and it just made my mouth really dry.
She definitely drooled, and you could tell that she was keeping her mouth open all night. We went for different opinions and went to Dr. Caulfield, who said, I have this great new system. It's the VIVOS system. When we went in, he looked at her mouth and said, immediately I can see that she's probably a mouth breather, that her palate is atypical, that there's this product out there that could really help her. It's more gentle than a rapid expander. What it's going to do is shape her palate in a gentle way to let her body grow into it, and I think that that will help reduce the time frame that she'll be in braces or orthodontics.
It just gave me hope again, and I wanted to go out and take pictures and do the things that I wanted. And it was definitely difficult being in high school and remembering to put it in and stuff, but I'm definitely happy I did it, and I'm really glad that I didn't go the normal way.
I think I saw a difference in her teeth pretty quickly, and even Dr. Caulfield saw a difference in her teeth pretty quickly. It depends how often you wear it, and if you're doing it per program, which we had a couple of times where it was definitely hey, this is an expensive thing and we need to, orthodontics is expensive. So in that, she learned how to do the program and stuck with it, and once she stuck with it, it really, you could tell a difference pretty quickly.
Thanks. Yeah, I'm a lot more confident, day to day, even just walking around and smiling at people, and I just feel more like a teenager and not so scared to show who I really am. So I feel like teeth are a big part of how you present yourself, and if you feel positive about your teeth, then it'll show you in a positive light.
One benefit though that we didn't talk about is that you got to wear it at night. Yeah. And you didn't have to do this during the day. And so everything, she'd come home from school, put it in, even though she talked a little funny at first, it wasn't all the way through school, she wasn't embarrassed. And shortly after that, we found that the way that she was holding her mouth at night was making her not do the mouth breathing.
My snoring has definitely gone away. My drooling has reduced immensely. I just feel more comfortable when I sleep. I feel like I get a better night's sleep. So I play sports. I play 2 sports. And so just my breathing in those have been a lot better. I have a lot more stamina for running, and it just feels like everything's more open. It just makes it much easier to breathe.
I feel like we made a really good decision. We would still be sitting here in braces, and she would still be mouth breathing, and we'd probably have to go back in a number of years and do something different for all of that anyway. She's getting ready to do her senior pictures here pretty soon, and she's happy about that. And I think the outcome for her teeth, the way that we talked to Dr. Caulfield about it, is that we're not going to have to redo this later, and that's a huge savings and less pain.
If you're looking for braces, I would strongly recommend looking at the VIVOS system. It really worked for me, and I just really recommend it.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the VIVOS appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the VIVOS appliance. As soon as I started treatment with the VIVOS appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the VIVOS appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the VIVOS appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs, and we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the VIVOS appliance, if this would be good for you, then I recommend you coming into a VIVOS center to be evaluated to determine if this is something that could help you.
So I would wake up every morning and my jaw would be locked shut. I would wake up with a horrible headache, not quite a migraine, but a horrible headache, and I would have to massage the sides and rock my jaw side to side, and sometimes it would open up in about a minute. Sometimes it would take 5 days. I could talk, like I could only open it about 1/2 inch. So anything I ate would have to be like cut up like you were feeding an infant. If I would laugh, my jaw would lock open. And that's humiliating because you can't hide that. I couldn't yawn. I would have to hold my mouth shut and try to yawn with my teeth together so that I wouldn't expand my jaw, open my jaw, and then end up locked. Right before I had the VIVOS system, I went through a period where my jaw was locked for 2 months and 3.5 weeks. And it was locked about 1/2 inch open, so it would be in the closed position. Every time I would eat anything, even if it was something soft as spaghetti and meatballs versus something hard and crunchy like an apple or hard pretzels, the popping was so loud that no matter where I was dining, everybody at the table would hear it and comment on it. So I've developed quite a complex and a little bit of anxiety about eating outside of my immediate family. Anytime I opened and closed my mouth, even without food in my mouth, it was loud. It was obnoxious. Even my oldest son would tell me, "Shh, I can't hear the TV." For the past 20 years at that time, no other doctor or dentist or orthodontist even could even think of a practical remedy for what I was going through. My dentists all told me that the only way to fix the popping in my jaws and the locked jaw is to have a very barbaric surgery, which I would never go through. So I just lived with the discomfort and the pain and the irritability that it caused. Eating a sandwich, opening my mouth wide enough to eat a sandwich was a challenge. But I just decided I was going to live with that for the rest of my life. It got so bad that it actually became a disability while I was active duty, because the migraines and the ringing in my ears was overwhelming. So I ended up retiring after 24 years, and I stayed home and I was volunteering at my son's school in the library, and the librarian and I were just talking and my jaw locked. She had told me about a doctor in Denver, or in the Denver area, that she found, Dr. John Caulfield, and that he was doing wonders for people who had the same issue that I had. So I made an appointment, and I went up to talk to him, and he spent about 2.5 hours with me. He talked to me about the VIVOS system, and I saw tremendous results. Within 3 days, the locking stopped. I would say within 3 to 5 days, the locking stopped completely. And in about 2 weeks, my headaches were completely gone. And my jaw has expanded 11 millimeters. My top palate has expanded 11 millimeters. I have 0 popping. I have 0 lockjaw. I have 0 headaches. I'm very skeptical. I'm one of the most skeptical people around. So if anybody wants to try to sell me something, I'm a hard sell. But when I sat and talked to Dr. Caulfield, I was still a little skeptical, but his depth of how it worked and how he showed me, and then the results that I've had, unbelievable. Whoever doesn't try it is going to miss out on potentially one of the best decisions they've made. I'm quiet when I eat, and I don't draw attention to myself anymore, and it doesn't hurt, and it's not a painful experience. It's a pleasant experience. It's changed completely. Yeah. I wake up headache-free. I wake up with a loose jaw. My breathing, for instance, my sinuses are even more clear. If it helped me, and with the barbaric treatment plans that other doctors over the course of 20 years have told me was my only hope, then it will help you.
Hi, I'm Diane Beatty, and this is my daughter, Amber.
So prior to the VIVOS system, I was dealing with migraines, and they would happen pretty frequently, about a couple times a month, and so that was a concern, and we actually didn't realize that your teeth and your mouth could be related to that.
She was in middle school, and her teeth were a hot mess, none of them aligned. They had always told us that her jaw was very small and narrow.
I'm not exactly sure all the problems that could have created long term, just that they were concerned enough about it that they really made a point to tell us about it.
The bar across the roof of her mouth was the only thing that dentists and orthodontists recommended for her.
It sounded very invasive and not so fun, so I wasn't a fan of it.
When she would get a migraine, it would come on pretty fast, and she would end up getting sick to her stomach and just be laid out.
So initially when we went in to see Dr. Caulfield, we just wanted to, get my teeth done and straight and looking nice, and he was able to pinpoint my migraines as a problem that was coming from my teeth and my jaw and all those things. And so he really explained to us that it was a real possibility that my migraines could be decreased or even eliminated through the VIVOS system.
The reason we went with the VIVOS system versus traditional orthodontia is less pain is a big one. It's more natural. You don't have to wear the appliance all the time.
The way he explained it to me was just really, it was a lot more comfortable, it's a lot easier to deal with, and it's not as apparent that you're going through such changes.
It's a more natural way to move your jaw.
Big thing for me was that the migraines that I had been experiencing started to decrease in frequency. And so that was a big deal because it was a difficult part in my life.
The fact that they were decreasing in number was amazing. It was freedom, really.
I love being able to not take medications to deal with my migraines because it's kind of a never-ending cycle when you're just kind of covering it up with the medication. And so the VIVOS system allowed us a way to address the root cause and truly eliminate it.
It's just more natural way of tapping into your body's strengths and correcting it.
I love my teeth now. They've turned out amazing, and that's largely because of the VIVOS system, and the room that it created really allowed him to go in and straighten my teeth and do all the things that we wanted to do with it. So it's great. I love it.
It is such an amazing way to handle teeth problems as well as body health.
I would just say that I'm very thankful for the VIVOS team for coming up with such an innovative and new solution to a problem that a lot of people deal with.
Thank you so much to the VIVOS team. And I have referred so many people to get this system and look into it because the benefits go far beyond dental health to whole body health, and there's no side effects.
My name is Lauren Johnson. I'm from Littleton, Colorado. Since I can remember, I've always had jaw aching, to the point where it gave me headaches at the end of the day. And it would pop every time I spoke. It wasn't just when I was chewing or anything, it would constantly pop. My muscles were constantly working more than they should have to because my teeth were out of line. Dr. Caulfield was actually the one that kind of pinpointed it. He was really the one that kind of accurately was like, hey, have you had jaw pain? I was like, yeah, but I kind of thought that was just normal because I've had it for so long. He took x-rays and looked at my jaw and felt it popping every time I talked. He said, are you having these symptoms and this system? And I was like, yes, yes, and yes. Proposed a solution like the VIVOS system in such a way that made sense. My mouth should have always been that way, and I get it. It put my jaw in the place that it was supposed to be in, because he said that it was so unaligned. After the first 3 days, I would say the VIVOS system really started to help. I could notice that I just felt my teeth in the back starting to touch together, which I didn't know they weren't touching until I felt them touch together. I didn't know it was wrong until I had them in the right place. I just felt more rested at night too, and I was like, I don't know if I'm crazy here, but it's helping me sleep because I was breathing through my nose more. It was kind of helping my nasal airway open up a little bit. So I would say I noticed a difference in the jaw pain 3 to 4 weeks after using the VIVOS system. My jaw had to work less, and my muscles had to were finally relaxed for a change. And that's what kind of caused all the jaw pain to begin with, was my muscle was constantly trying to pull my jaw shut, but it couldn't do that because my teeth weren't lined up. So when the VIVOS system addressed that, it pretty much went away quicker than I have ever expected it to. My jaw does not pop anymore. And so once that went away, I was like, this is great. This is how it should have been. The way I feel after I sleep in it versus a day I might have forgotten to put it in or I was too tired to put it in, I wake up so groggy. It is, pardon the pun, but it is night and day, with the system. The VIVOS system I'm so grateful for because it was a great alternative to braces. I'm a young professional. I need to go to interviews. I'm trying to get into grad school. If I had braces on, it would have just crashed my confidence. And so it was such a great alternative to braces. And I think it had more of an impact than braces did, just because it restructured my mouth to where it should be. I even noticed with the VIVOS system, I kind of got cheekbones, and cheekbones started popping out. Just looked like my face is what it was supposed to be, should have been all along. I have to thank the makers of the VIVOS system so much, because it saved me from like years and years and years of pain, which I cannot say enough. Like, just no more headaches. It's just been awesome. And so I tell my friends about it. I think everyone should check this out. Like, I think it is life-changing.
Getting old wasn't actually about energy. It's more about sleeping so that I have the amount of energy that is needed to do these classes with my dogs. My name's Jeanette Hayward. I live in Warrenton, Oregon, and I've been wearing the VIVOS appliance for about 5 years. Not being able to sleep at night, nothing works well in the daytime. I would wake up several times. I couldn't get comfortable. I was on my stomach to see if that would help. Switch pillows. I must have a dozen pillows, and nothing helped. Nothing was helping. I was a teacher, and I would tell my students that they could call me anytime if they had a question. And then I had to say, well, you can't call me past 9 o'clock, and then you can't call me past 7, and finally I'll help you after school, and then I finally quit teaching. So it definitely affected my life. So I was a dog trainer as a high schooler and in my 20s, and I had dogs, and when they passed away, I couldn't get any more because they required more attention than the energy that I had to give. I mean, they put me on sleeping pills, which I absolutely hated because I couldn't wake up in the morning. I felt too groggy. The next thing that the doctors were, you need a sleep study and a CPAP machine. I can't stand those, so my husband had one at the time, and it was like, nope, that's not going to happen to me. I think Dr. Klemp was the first dentist that asked me how I was sleeping at night, and when he looked at my mouth, looked at the ridges on my tongue, which were another indication that I didn't have enough of an airway in order to sleep at night, and then he started asking questions, and he said, well, I have something that could help you. Slowly after I got the VIVOS, because you don't get the energy, I didn't get the energy all at once. My body had a lot to heal, and so the very first thing I did was get a dog. I got Gracie, my oldest poodle, and as my energy increased, then I was able to do things with her. So we started taking scent classes, and we started going to different dog shows, and I thought, well, I could even handle having puppies again. So then I bred Gracie, and we have Faith, which is her daughter. I don't know if you know anything about agility, but it takes a lot of energy. And I didn't hesitate because I didn't have any energy, which would have definitely put the skids on anything like that. Oh my goodness, I am so grateful. I get to do things now that I would not have been able to. My dogs and I go all over the Pacific Northwest, and I couldn't have done it if I wasn't sleeping. The money that I spent is nothing compared to what I've gotten back, and how I can now enjoy life, enjoy a conversation with my friends, but not have to say, oh, I'm sorry, it's 5 o'clock and I'm done for the day. I would not hesitate to do it again. I have a whole different life than I did 10 years ago.
It's definitely changed our lives. The VIVOS system has made him able to eat more foods, better foods, healthier foods, been able to give us some freedom of not having to prepare his foods and puree it and what have you. Huh, bud? Yeah. Isn't it good?
Yeah.
Yeah. My name is Julia Bangasser. This is my son, Matthew Bangasser. He had spent a lot of time in the hospital when he was born, which caused his palate to be, top palate to be constricted. So his top teeth did not match up to his bottom teeth, and his chewing was not very effective. So we would puree everything in the blenders and the food processors. That gagging was a big issue, especially to let him go to school, and choking and gagging on his food. We've had quite a few instances at home where we've had to jump up and dig things out of his throat because things have gotten past his chewing that's too large. And there's been a few instances at school also that I've had to do the Heimlich on him. We knew that there was palate spreaders out there. Most of our dentists that we went to did not want to put the permanent appliances in there. It caused too much heartache on Matthew, and he wouldn't be able to handle it. There was one dentist that, because of his jaw being behind his front teeth, top teeth being behind his bottom teeth, he wanted to break his jaw and reset it. Yeah, that's what I looked at yeah, no, you're not doing that to my child. Yeah, he said that was the only way to do it. We went to Dr. Caulfield, and he recommended the VIVOS system. We've used it ever since, and we're getting great spreading of his palate. That is now his top teeth are meshing with his bottom teeth, which makes his chewing very effective. Yeah, so, and the teeth itself are just moving all into place. Without having to drag them into place with braces, we were able to move, they just automatically moved on their own, right into place, so they're, the molars are where they should be, the canines are coming down, that kind of stuff. So just by spreading it, all the teeth started moving to where they should be. Oh, with braces and stuff, that would have been much more painful. Probably taken longer. It's letting the body do what it does naturally, you know, not forcing a tooth in one direction or another. It's just moving it and letting the teeth drop where they should. And it's just amazing that they do that. The human body does that, you know. You know, the VIVOS system can't be any easier. And the movement it got was incredible. And just to have him eat on his own, that's always been a big issue with us. And so I'll know he can eat things in the restaurant with somebody who's not his parents and worrying about every chew, you know. That's a big improvement. Now you're chewing, dude. You're biting sandwiches, you're chewing on your own. The pre-prep of the food is nothing anymore. But yeah, the teeth meet better, he's more efficient at it. I think he talks clearer. Is the VIVOS system comfortable?
Yes. Yes, the VIVOS system is comfortable for me.
He's never really had any pain with it that he's told us about.
Yeah.
So yeah, he's very comfortable with it.
Well, I've been chewing more, like my mom said.
You've been easier for you to chew?
Yeah.
Maybe some more complex food?
Yeah.
But you haven't been able, more increasing the textures and stuff?
Yeah.
That you've been able to choose and not gag on, huh?
Yeah.
Yeah, things are falling into place. It's just a big improvement to our lives to be able to eat normal food.
Yes, I would recommend the VIVOS.
Why?
Because it really helps me a lot.
I was a three-sport athlete in high school. I played football, basketball, and baseball. And one of my coaches would call me the mouth breather because I couldn't breathe out of my nose, which is pretty funny now looking back on it because that's a big issue. You need oxygen in your blood and your muscles to keep going, and having the ability to breathe is very essential for that. When I was about 8 years old, I started snoring, and my father had sleep apnea, and at the time I didn't really know what that was or what it meant, and I didn't think anything of it. But then eventually we ended up moving, and our next door neighbor was my dentist. And my dentist found out that I was a snorer and that my dad had sleep apnea, so he had me come in, and he immediately starts telling me about this appliance, which is now the VIVOS appliance. And since then, it's been probably about a year and a half, and I'm breathing amazing, actually, because I used to not be able to actually run and just breathe out of my nose. You know, this is something I did realize once I was able to start breathing out of my nose, just relaxed. I didn't have to kind of like keep my mouth open all the time, so I was kind of just able to let my body do its normal thing, and I think that actually helped me relax just in general as a person. My lower jaw was crowded, and it was actually shaped in, and that my dentist told me that that was also a major issue I needed to deal with. And luckily for me, the lower portion of the device helped fix that. So not only am I breathing better, but my teeth look better. I can just breathe through my nose. I don't snore anymore, and even though I'm supposed to wear the appliance pretty much every night, if I forget a night here and there or whatever, it's fine. I still don't snore or anything. And I have less jaw tension because I no longer have to keep my mouth open to be running or anything, sprinting. And I just feel more active and able to be active. Oh, I highly recommend it. I've actually talked to some of my siblings about it. I have a couple siblings that do snore. And I have a couple friends too that when I was in college, they were snoring. They were some of my roommates. And they were actually wondering about the device because they noticed that I stopped snoring. And I told them about it, and they've actually been looking into it. I am 100% happy that I did this. And I'm thankful every day that I have it because I can breathe.
So starting my senior year of high school, I started getting really bad headaches. I went to the doctor, they told me it was tension headaches. I went all sorts of migraine medicines, went to masseuse and did a lot of drinking chamomile tea and all of those things, and they just weren't helping. It was just a lot of hit and miss. So I spent 4 years with horrible headaches until finally back in '09, I was having my teeth were hurting, so I went to Dr. Caulfield at Epic Dentistry and found out that I needed a root canal. And it was during the process of the root canal that we found out that my bite was off. Dr. Caulfield suggested the VIVOS system as a way to expand my upper palate in order to make my teeth actually align with each other, so I could actually close my mouth fully. I guess you don't really think about when you're getting a headache, you think you should go to the doctor, that it's a head problem. You don't think about how your body's connected, that it was actually a bite tooth problem that was causing my headaches. I didn't even think about it. That's why I didn't even go to the dentist to start with. I spent 4 years going to a doctor thinking that that was going to solve my problems. I was getting popping like with my TMJ, so he was saying we need to do something to fix the bite is what's going to solve all of these problems, and he said if I expanded my upper palate using the VIVOS system that would help fix my jaw problems and actually make all of my headaches go away. I think I had the system total for 1.5 years, and it was almost immediate that I could see a difference in how my teeth were aligning with each other. Once the teeth were aligning, my headaches slowly started going away, and right now it's been 5 years since I've had headaches. Drastically changed my life because I wasn't having to take pain meds every day and be concerned about what foods I was eating, whether it was going to hurt to chew. So it's made my life so much easier. The VIVOS system changed how I live my life. The fact that I'm able to just wake up every day and not worry about how painful my jaw is going to be or how soon it's going to be till I have a headache has vastly impacted my life. The VIVOS system has allowed me to just feel more confident about myself. Before my face was always closing a little bit left, and now it closes evenly, and it just increases my happiness with just how my everyday face is. I don't snore at night anymore. I mean, that's something nice. I think it is easier to breathe every day. The fact that I don't mouth breathe as much as I used to is also a confidence booster, I think. It made it so I could close my mouth fully, so I didn't always have my mouth kind of open, which is kind of awkward. So, I mean, it made me more confident in who I am and how confident I was with how I look and feel. My advice if you're getting headaches and migraines that it might not be a medical doctor problem. You should seek out your dentist. It could be a jaw teeth problem, and the VIVOS system might be the answer for you.
My name is Chandra. I'm a practicing herbalist, and I have a shop here called Wild Root. I've always been interested in health. I mean, because of my health issues, and I'm interested in alternative and complementary care. The store really was born out of that passion. I actually own it together with my husband, Eric.
I'm Eric. I'm the barista.
So about 3 years ago, when we started the business, like any new business owners, we were working hard, 11, 12 hours a day. But I especially was exhausted because I'd known I'd suffered from sleep apnea my whole life, and I knew I had to do something about it. Ever since I was a child, I have experienced breathing problems. All throughout my 20s, I had severe sleep apnea, complete exhaustion. I mean, for the last 20 years of my life, just suffered. I'd wake up after 8 to 10 hours of sleep completely exhausted.
I know this video should be more about me and my ability to sleep with somebody who has sleep apnea. She was snoring quite loudly and often.
I had done some research and learned about epigenetic orthodontics and the work of Weston A. Price. But I figured I would have to travel to a big city to have that done. And then I found out that Dr. Griffin was right here in Panama City Beach. And I was able to go to her, and she did a sleep apnea test. And I didn't present with any of the typical other conditions that people who have sleep apnea have. So we were both quite surprised when she found out that my test came back as severe sleep apnea, like off the charts.
Off the charts, yeah.
Dr. Griffin recommended that I wear the VIVOS appliance approximately 18 months to 24 months. I wear it every day, approximately 15 to 18 hours a day. Well, there's been drastic improvements in my life. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary.
Yeah, she made
it's
a
pretty
point
crazy.
one morning just to like say, I can breathe through my nostril again. I haven't had that happen ever.
I've been getting amazing sleep. I wake up, I feel rested. One of the biggest changes in my life, I don't have to use the CPAP anymore. Now I'm just using the appliance for the remainder of my treatment. And I've actually started an exercise program, which I just wasn't able to do before because I was just exhausted all the time.
The difference is more at night. You can just hear her breathe easier. Her snoring was very loud and stop and go. It's almost like she stopped breathing and then she would breathe and snore. When you hear somebody laboring like that when they're asleep, it's worrisome. But now it's much quieter and I'm able to ignore her just fine throughout the night, yeah.
I think it's an excellent thing that people should explore because it's non-invasive. I found the treatment to be very easy to incorporate into my daily life, so I would definitely recommend it to people.
She's sleeping better, I'm sleeping better, you know. She has more energy, I don't, but that's okay.
Both my lower and my upper jaw were extremely narrow. When they widen the palate, it gives more room in the sinus cavities, expands the jaw to a shape that is where it's supposed to be. Basically, the appliance expands the jaw and just opens up the airway. I feel like I have more room in my mouth. It feels completely different. I feel that it has pretty much made me feel excited about life again. You know, I mean, just when you get up in the morning and you have energy and you can do all the things that you want to do, I mean, that in and of itself is just, you really feel like you've been given a new life. I know that sounds dramatic, but it's true. I mean,
now she makes me coffee and does laundry. Oh no, wait, no, I still do that. Never mind. Sorry.
I'm extremely grateful for the VIVOS appliance. It has drastically changed my life.
You know what they say, happy wife, happy life. So, you know, I'm grateful as well.
Hi, I'm Scott Cornell from Panama City Beach, Florida, and I love camping with my boys and very involved in scouts. We camp usually at least once a month, if not more. We just love to be out in the outdoors. Living in Florida, there's so many great places to be. Unfortunately, we found that I wasn't enjoying my camping with my sons as much as I wanted to because I was always so tired, way low on the energy level. I started realizing I had an issue with my sleeping and my health about 5 or 6 years ago. Turned 40 and did my initial 40-year-old checkup thing, and I finally realized that I know that I've been having breathing issues and sleeping issues, but my doctor suggested I go see a specialist for it. And we tried the CPAP for a while, and it didn't really work too well. I couldn't really take to wearing it, never really got through a full night of wearing it, and I didn't see any improvement in my symptoms. So he referred me to Dr. Griffin and went through the process with Dr. Griffin of doing a sleep study and getting kind of a baseline of where I was with my sleep apnea. So Dr. Griffin recommended I try the VIVOS device, which is really just a small mouthpiece, almost like a retainer you'd have for if you have braces. Right after I started using it, I noticed the results really, especially with the snoring, right away. My wife, even the first night or second night, she was like, "This is great." And consistently, if I forget to put it in or don't have it in for some reason, fall asleep on the couch, she's like, "You got to put your mouthpiece in it." It's very simple to wear. It's easy to do. It takes a little getting used to in the beginning, just like a retainer would that you wear in your mouth. But it's just a piece of plastic and metal that just pops right into your mouth and immediately helps to keep your airway open. And another great benefit of it is the fact that it's this big, and I can take it with me when I travel. Camping is great. I have one little piece as opposed to trying to run an extension cord halfway across the campsite to someplace there may or may not be power. I think the VIVOS is great. I have recommended it to other folks that I camp with. A lot of the other dads do have the CPAPs and have rigged up a marine battery with a power inverter, and they have it in their tent and they're all night long with the CPAP. Before getting the VIVOS device, I had a sleep study done at an actual sleep center where you get hooked up to all the wires and they take all these readings of the number of sleep apnea episodes you have over the course of an evening, as well as your snoring. And then you wear the VIVOS device for a specific amount of time. And then at the end, or recently I just had another sleep study done, and my sleep apnea episodes are a fraction of what they were before. I think that the VIVOS device has benefited me in my day-to-day life, most importantly because of the fact that I'm not falling asleep all the time. I can sit and watch TV, I can watch a movie with my wife, I can be at work working on paperwork or whatever and not feel like I'm very, very tired because I've gotten enough sleep the night before. I think I'm a better husband and father because I'm more less punchy, I had a better attitude about things. Camping's awesome. I just got back from camping this weekend. It was beautiful, and I'm able to do pretty much anything I want to now. This product's phenomenal. It changed my life for how I can sleep and how I can carry on with being active and doing things and traveling and not have to become encumbered by CPAP, and I definitely recommend it to anyone.
My name is Sue Gordon. I'm from Littleton, Colorado. Been here since I was 7 years old. I go see Dr. John Caulfield, and he had asked me during a visit one time if I had issues sleeping at night, if I was a mouth breather or nose breather. He noticed that I had a hard time talking because there wasn't enough room in my mouth for my tongue. And so he wanted to broaden my mouth open for more room for my tongue so I could talk. Then he introduced me to this VIVOS system and told me that what it would do and how it would open up my jaw and my tongue would lay flat on the bottom of my mouth, and I'd have an easier time talking and being able to sleep at night through my nose, breathe through my nose and not through my mouth. He had me open up my mouth, and I had a mirror, and he said, "Look and see how your tongue doesn't fit on the bottom of your mouth. Your tongue is cupped where it should be flat and be able to move around, whereas mine didn't." I noticed that my tongue did kind of collapse in the bottom of my jaw, and in the morning when I'd wake up, my tongue would be dry and almost stuck to the bottom of my my jaw. It was hard to get used to with having something like that in my mouth, but after I wore it for about a month, then I noticed that I was being able to breathe through my nose at night. I can tell that my jaw has gotten wider and I do breathe through my nose and my tongue lays pretty flat. When I come back in for the checkups, Dr. John has noticed that my speech has improved because I'm not fighting my tongue in a small area. My jaw was a U shape when I had braces. Over time it's moved to a V shape. So what he's doing is he's bringing it back out again, and now my tongue can lay in there instead of being cupped and nowhere to go. Breathing with my nose, he said I had my nose is off a little bit because the nostrils aren't the same size. He's noticed that that's starting to clear itself up. But that's the biggest thing I notice at night is that I can breathe through my nose. My speech has corrected itself. I can tell just in pictures of me from the past until now where my jaw has squared out more versus being more narrow and confined and more pointy. It's flattened my face and my jaw out, which then allows for the tongue to lay flat. My teeth are starting to go back to where they used to be. I think the breathing is very important. I think I sleep better at night. It's a more restful sleep than I had before. I wake up in the morning and my tongue is not dried and stuck to the bottom of my mouth. As far as the nose breathing, I think then it's also a calming thing. Having done yoga in the past, I know that when you breathe in through your nose, that way it's more of a calming effect. And as skeptical as I was, I'm glad I did it.